everyone. I'm inviting everyone for a tea conversation. So, mahilig ako magtsaa and mahilig din ako mag-coffee. Uh, let's make it more meaningful by discussing things habang nagtsatsaa tayo. So, ang pag-uusapan natin ngayon is about bad breath. Ano ba talaga yung bad breath? And I believe one of 4 people is experiencing this. It's very common, nasa sobrang common niya hindi napapag-usapan sa clinic dahil merong mga stigma na nahihirapan mag-disclose yung pasyente dun sa dentist. Bad breath is also known as halitosis or fetor oris. And it could vary at some degree and merong mga maraming symptoms kung bakit nagkakaroon ng ganun yung patient. So, bad breath or halitosis, maraming causes kung bakit siya nangyayari. The number 1 cause is the poor dental hygiene. Ito yung very common na nangyayari sa mga pasyente. Pag hindi kasi maganda yung hygiene mo sa oral, madalas nagkakaroon ng bacteria buildup. Pag hindi regular yung brushing mo, aside from brushing, hindi ka nagfo-floss. Aside from flossing, hindi ka naglilinis ng tongue. By cleaning the tongue, also is part of your regimen dapat pagdating sa pag-maintain ng oral cavity natin. Aside from that, pag yung plaque build up hindi natatanggal, it's because hindi frequent yung pag-brush mo ng ngipin. And dun sa mga nagde-dentures naman, every night, you're supposed to clean them properly. May mga nabibili over-the-counter medicine para panglinis ng denture. Because kapag hindi natin siya nalilinis, tapos ginagamit natin siya, kumakain tayo, at nagstay lang siya as in for the longer period of time na hindi mo nalilinis or overnight, it could cause bacteria build-up. And yung bacteria yung nagkukos ng pagbaho or pagkakaroon ng bad breath. Another cause ng bad breath is the strong food and beverages. Strong food and beverages like onion, garlic, and other strong foods, spicy foods also could cause that. Yung strong odors nun, nanggagaling siya dun sa oil na naa-absorb ng bloodstream mo na nagpapas pabalik dun sa lungs na magkakos ng pag-bad breath niya, usually up to 72 hours pa the most. And also drinking coffee, strong coffee could also lead to bad breath. Also, smoking. So, huwag natin kalimutan yung paninigarilyo. It's very common, no? Kahit na minsan nga, hindi naman ikaw yung nanigarilyo, maamoy mo lang yung hininga nung nanigarilyo, maaamoy mo na kagad na hindi maganda yung amoy. So, smoking also one of the things that contribute to halitosis. Another thing is the sinus, mouth, or throat conditions. Most of the time, these are infections. Sinus infection, postnatal drip, chronic bronchitis, infection in your upper and lower respiratory tract. Sometimes it causes bad breath. So, it's good to check this, yung mga to, kung bakit nagkakos ng bad breath yung pasyente. Sometimes kasi, magpupunta siya sa clinic, ang feeling niya dahil lang yun sa oral cavity without them knowing na mayroon pang underlying conditions behind it. Another one is yung mga underlying disease. This is what we call yung mas chronic pa. Ito yung parang nagpunta ka na sa dentist, nag-floss ka na, you did all the things, tas hindi pa rin siya nawawala. This is what we call GERD, yung gastroesophageal reflex. Yun yung commonly causes the halitosis. Yun yung nag-include yung mga kidney disease, diabetes. Sometimes, dahil dun sa mga problems na yon, nagkukos yun ng halitosis. So, my advice is for you to check kapag ka nanggaling na kayo sa dentist tapos hindi pa rin umokay yung condition at parang lahat ginawa nyo na, you take all the things that is needed, hindi pa rin siya nawawala, it's better to have your overall medical check-up para ma-check natin saan talaga siya nanggagaling. Hindi porket sa bibig mo lang siya naamoy, meron kasing indication kung bakit siya nangyayari. But syempre, it's important to check nyo pa rin muna kung ano yung problem nyo when it comes to dental. Then afterwards, kung hindi pa rin siya nawala, tsaka nyo siya i-consider na yun yung problem nyo with regards to bad breath. And yung hinuli kong cause is related to us dentist. Ito yung mga periodontal disease, caries, yung mga root fragments, yun yung mga mostly na nagkukos ng bad breath na kami yung concern. Let's talk about periodontal disease. Periodontal disease is it's a disease in the mouth nag-involve sa gums. Most of the time, ito yung pag-swollen yung gums mo, nagbi-bleed. Nangyayari ito madalas sa mga diabetic na patient. They are prone to have periodontal problems. Aside from that, yung mga patient na nag-undergo ng mga chemotherapies, yung mga ganong patient, so prone sila sa mga ganon. Another one is yung mga pregnant women. We observe na kapag nabubuntis yung mga babae, mas prone sila, nagkakaroon sila ng periodontal problem. Aside from that, yung periodontal problem is brought about, again, babalik tayo dun sa bad oral habit. Okay? Pag napabayaan natin na hindi tayo nakakapagpa-cleaning regularly, at hindi natin na-observe yung proper brushing, proper flossing, it would cause periodontal disease. Kasi all of this, yung periodontal disease is parang yung endpoint ng lahat ng ginagawa mo towards your teeth, yung kung paano mo siya alagaan. Pero, syempre, we need to check palagi. So, paano mo malalaman kung kailan ka ba dapat? So, let me remind you na ang cleaning kasi dapat is every 6 months. Dapat every 6 months, lalo kung regular or normal ka lang naman, wala kang any conditions, hindi ka naka-braces, every 6 months dapat nakakapagpa-cleaning ka. Even if you feel na parang mukhang malinis naman yung ngipin mo, you need to have the professionals or the dentist check this to know kung ano pa yung mga dapat mong i-check. Aside from periodontal disease, hindi lang naman kasi yun yung chine-check natin when you have a routine dental checkup. Usually, chine-check din natin kung may caries. Kasi yung mga caries, nakakapag-cause din siya ng bad breath and halitosis. Another one is yung root fragments or yung mga sirang ipin or yung mga ngipin na badly caries na. Yung talagang nasira na talaga siya. Yun yung mga most na chine-check natin na conditions bukod sa teeth, yung gums nyo, yung periodontal nyo. Yun yung mga chine-check natin kung bakit nagkakos ng bad breath. So, if alam na natin yung cause, maybe it's better to know ano naman na yung dapat nating gawin na treatment once na mapansin mo na parang ganon. So first, kailangan mong i-diagnose if it's chronic or acute, kung saan ba talaga siya nanggaling. So pagka nalaman mo na, let's take it one by one. For example, galing siya dun sa medical condition mo, you need to have it checked sa doctor. I am not very professional on how to do that. Syempre, hindi naman po ako doctor. So, if may mga ganong condition kayo like GERD, meron kayong post-nasal drip, yung mga ganong conditions, infections, you should check to your doctor to have it treated. What are the treatment options for bad breath? So, first, my advice is you need to go to the dentist to have it checked. Have a dental checkup. Check natin yung periodontal ligament nyo, kung ano yung conditions niya. I-check natin yung overall health nung oral cavity nyo. Check natin kung may caries. I-check natin kung you need cleaning. If yung mga yon is nagawa na-check na natin, na-clean na, deep cleaning, pag nagawa na lahat yon, your dentist will prescribe you some routine treatment na pwede nyong gawin sa bahay. Like, for example, brushing, kung ano yung stroke ng brushing na dapat. Usually, pagka nag-brush tayo ng ngipin, it should be vertical. Parang pag ganon yung stroke ng brush. Ganyan. Tapos, aside from that, your dentist may prescribe you a certain toothpaste that would be good for you. There's so many toothpaste in the market that would cater to your needs if you're sensitive, if you have gum problems. Yun, and afterwards, tuturuan niya rin kayo kung paano mag-floss ng tama, kung ano ba yung dapat na binibili, like tongue scraper para malinis yung tongue. Aside from that, kung ano yung mouth rinse na pwede nyong gamitin. All of that would be prescribed by your dentist. But for sure, generally, alam nyo naman na lahat yan. And also, you do it religiously. Dapat, as in, pag sinabi natin everyday, you commit to it everyday. As if Yun yung talagang gagawin mo palagi to protect your teeth. Hindi pwedeng pag naalala lang. Okay, after that, pagka na-check na lahat-lahat, tapos meron pa rin, nagpe-persist pa rin, na-rule out mo na hindi siya galing sa mouth, your dentist will refer you to a medical doctor that would check the condition of your overall health. They will check your kidney, your liver. There are certain tests that would give you data or give you a diagnosis on that kung ano man yung problem nyo. Pwedeng yung GERD nga. So, how can you prevent naman halitosis or bad odor? So, kanina din-discuss natin kung paano yung treatment if you have halitosis. Paano naman kung ipe-prevent mo siya? So, first, I would like to remind you again, na paulit-ulit ko na-remind during this tea conversation natin, brushing is important. Okay? Brush your teeth twice a day. At least. If you could do it 3 times a day, every time nakakain kayo, much better. But at least twice a day. Flossing is important kasi hindi lahat ng dumi ay nakukuha ng toothbrush. Kailangan makapag-floss ka talaga. Kahit once a day lang. Mouth rinse is added protection. Aside from that, yung mouthwash na available ngayon sa market, most of the mouthwash is antibacterial and antimicrobial. So meaning, kung meron kang mga problem sa mouth mo, it will kill kung ano man yung germs. Kasi remember, kung galing yan sa bibig, kaya nagkakaroon ng baho or pag nagkakaroon ng bad breath is because merong bacteria. Aside from that, we need to be hydrated. I cannot emphasize enough kung ano yung importance ng water sa atin. So, water could also prevent having bad odor sa mouth natin. Also, other thing, stop all the vices. Stop smoking, kung ano man yung mga bad habits that you think na magti-trigger ng bad odor. Another thing na gusto kong i-emphasize is kung gaano ka-importante yung every 6 month na visit natin. Para dun sa mga normal na hindi naman naka-braces or hindi naman kinakailangan talaga ng routine, lagi na dental check-up, if you feel that you don't need, actually you need. Every 6 months is what we recommend you to go to the clinic kahit wala kayong nararamdaman. Para ma-check kung ano yung condition at ma-prevent natin kung ano yung pwedeng masira, ano yung pwedeng mangyari. And also, you need to replace your toothbrush at least every 3 months. Okay? Iniiwan natin yung toothbrush natin anywhere. So, it could harbor any bacteria, germs, na pwedeng maglinger sa atin. And aside from that, yung bristles ng toothbrush, pansinin nyo siya na pag tumatagal na, parang lumalaylay na siyang paganyan. So, dapat palitan natin siya. And kung pipili man tayo ng toothbrush, especially kung medyo sensitive ka, we recommend to use extra soft bristle. Check kung ano yung label niya. Pag bumibili kayo ng toothbrush, usually it could be found at the top of the toothbrush. Nakalagay doon hard, soft. If you could find extra soft, that would be better. Kasi, ang kailangan nyo naman is yung stroke. Hindi nyo naman kailangan ng matigas na bagay to clean your teeth. Kasi sometimes, cleaning hard naman could cause yung problem na parang instead na maging maayos yung ipin mo, magkakaroon ka ng mga parang sensitivity dahil sa sobrang pagtutoothbrush. So, you can clean that, pero pili ka ng toothbrush and yung stroke ang importante, make it vertical, not horizontal. With that, I would like to give you some advice. This is my personal advice to you. Huwag tayong masyadong mapraning. Okay? It's important na alam natin kung bakit nangyayari sa katawan natin yung nangyayari. Kailangan alam natin kung ano yung nangyayari. Listen to your body. Ibig sabihin, kaya ka nagkakaroon ng halitosis or bad breath, ibig sabihin there's something wrong. Kailangan mo siyang pakinggan at kailangan mong alamin saan siya nanggagaling. It's one way of your body giving you a signal that something is going on. So, kailangan alamin natin siya. Pero, wag naman tayong sobrang stress. Okay? Yung mga ganitong bagay, kailangan lang natin siyang ayusin ng konti, kailangan lang natin mag-practice ng ganitong konti, tapos maaayos din natin siya. And don't be shy to ask for professionals or for the doctors, the dentists, kasi nandito kami to help you. Alam na namin yan, na-experience na namin lahat yan, na-amoy na namin lahat yan. So, If you're feeling na parang feeling mo parang ikaw na yung pinaka may mabahong bibig, guess what? Hindi ikaw yon. Malamang may mas na experience pa kami sa'yo. Dito sa GC Dental Center, we always say na we are your family, and as your family, you can treat me as your ate or yung mga dentist natin as your ate to tell them what is happening to help you. It was nice having you in our tea conversation. Comment down below kung ano pa yung mga gusto niyong pag-usapan natin sa susunod. And see you again next time. Bye!